drivers, hey, all across North America, nice to have you on. Wherever you may be listening, I appreciate you joining me on the program. We're going to spend a little time on you, on your medical wellness. We're going to talk about what's going on with your hearts, and great to have with us Dr. Fahmi Farah, one of North America's leading cardiologists, the best at this, ladies and gentlemen, and she's here for you. If you've got a question for her about any of this, call us, and you know the phone number. Not here to diagnose you over the phone, obviously, but to give you some much-needed information that can certainly be taken back to your local doctor and let them evaluate you and go from there. And, Doctor, it's great to have you back. Welcome to the show.
It's great to be back. Thank you for having me back again.
Absolutely, absolutely. Great to have you on board. And, you know, one of the, I think, important things to look at when it comes to cardiology and understanding the warning signs of your body, that people may hear the term heart failure. And the reason I was bringing that up, watching TV the other day, that if you try this drug or that drug, it can maybe extend your life and maybe ward off or slow down heart failure progression. And thinking heart failure, does that mean the heart simply stops, or is that a gradual thing? Welcome back.
It's usually a gradual thing. Heart failure means that the pump of the heart is not functioning properly. So it's not squeezing to its fullest extent, and so the heart function is drastically reduced, and as a result, people can be symptomatic, and it can drastically reduce the life expectancy as well.
Okay, now would some of the signs of that be maybe increased shortness of breath? In other words, maybe somebody's used to walking to the mailbox, maybe can't do it now, or maybe when they get out of their vehicle, walking to a restaurant or a truck stop, that kind of a thing? Is shortness of breath an indicator?
It is. It is one of the biggest indicators, actually. People who have this condition, one of the first signs and symptoms they're going to have is shortness of breath, and you explained it very well. Just not being able to do what you used to be able to do, like, you know, the amount of walking or daily activities, like, you know, going to your mailbox, for instance, you'll just get tired a lot faster, not being able to climb stairs. So it'll just, like, limit you with shortness of breath. People can also get swelling of their legs. Those are the two primary symptoms and that people get initially.
Okay, and could the abdomen be part of that as well? In other words, if there's swelling around the abdomen or other parts of the body, could that be an indicator as well?
It could, yes. Typically, when you get that level of swelling, like, you know, in the abdomen as a result of heart failure, it's pretty advanced, and usually that happens when people are in acute heart failure.
Okay, so something to keep an eye on. I would imagine the shortness of breath, walking to the post office or mailbox, or walking from maybe from the car or truck to the truck stop, that sounds like fatigue all over that, correct? Is that a key indicator?
It is, yes. Fatigue can be an indicator for many different types of cardiac conditions, and heart failure is certainly one of them.
Okay, and also the thing about, like, a chest discomfort. Maybe somebody thinks, okay, maybe I'm having heartburn or indigestion problems. Could maybe chest discomfort be an indicator of that? How do you see that?
It can. You know, people can have chest pain. Typically with congestive heart failure, it's more tightness, because as they accumulate that fluid in their chest cavity, they start having shortness of breath. They can even have wheezing, and they can have chest discomfort with that and tightness.
Okay, and it's going to be noticeable, right? Not maybe a subtle kind of a thing? Is it, like, really noticeable with that?
Correct. It will be noticeable, yes. They'll notice a drastic change, and sometimes it could be gradually happening, and so a lot of times until it gets pretty significant, people don't notice it just because it happens gradually, and so they adjust to that as that becomes their new baseline. So that's one of the things to watch out for.
Okay, and is that a 911 call, doctor? Would you recommend 911 at that point?
Yes, if you're having significant shortness of breath, swelling, chest discomfort, that is an indication for a 911 call.
Okay, you know what's really interesting about the the length of time paramedics arrive, that call for 911 assistance goes out, and then maybe 5 minutes later, 6 minutes later, an ambulance will show up to the address where somebody is experiencing a medical trauma or a challenge out there. And when the time the patient is maybe loaded onto a gurney, that folks in the emergency room in your hospital, you'll know what's going on right there from the field. That's got to make it exciting, because you can start the healing process while the patient is en route, right?
Oh, absolutely, yes. And that happens in the setting of an acute heart attack, for example, when somebody calls EMS, and when EMS arrives, they will do an EKG right then and there, and that's how they can confirm whether this person is having an acute heart attack or not. And if they are having a heart attack, they will alert the ER, and the cath lab will be activated, because they will then alert the cardiologist and the whole cardiology team. We get ready before even the patient arrives to take that patient to surgery.
So, in other words, don't have to check in. In other words, right, just go right to the ER. Where the surgeons can go to work. You know, there's a reason I'm asking this story. There was a gentleman that I know that works in the news media with me in the Dallas area, Dallas-Fort Worth area, and he was telling me about the fact that he had a heart attack. It was a mild one. He had the pain, the tingle, the what do you call it? The tingling in the arms there, the kind of that strange feeling going down his left arm and his right arm, and he started to break out in sweat. Then he said, okay, I'm going to call 911. And he did that. And paramedics came out, and he was taken on to the ER, and come to find out, indeed, he had suffered a mild heart attack. And so he went through the period of some recovery. He did some cardiac rehab, I guess it's called. But then he picked up the habit of, instead of smoking half a pack of cigarettes a day, he cut it down to 2 cigarettes a day. And I thought, oh, man, somebody that goes through that, throw those things away altogether. Correct? The cigarette part, is that a major contributor to heart disease?
It is a major contributor, yes. And, yes, I recommend for people to completely quit smoking, especially if you've already had a heart attack. That's definitely the time to do so. That being said, going from 2 packs per day to, or however much, to 2 a day, that's an improvement. So congrats to that person for taking that lead. But, yes, I would say keep going. 2, and now make it 0.
Yeah. Oh, it just made me shake my head. It's like, okay, it's part of his regimen at night that he likes a little glass of wine, and which is fine, I guess. But, then after the heart attack, 2 cigarettes, and then he goes to bed. And I'm thinking, wow, okay, why not just stop altogether? But, again, it just goes back to the idea, and what made him, he's trying to cut down, but what made him decide to keep on going, he's got a daughter, just a lovely young lady in high school. And he's trying to do it for his family. And if somebody doesn't want to maybe give up some of these things, I mean, think about the family that you're going to leave behind if you pass away from a heart attack, right? Yeah, think about the family first. All right, Doctor, let's do this. I got to do the commercial break. And on board, Dr. Fahmi Farah is on, one of North America's leading cardiologists. And if you got a question or a comment, and again, not here to diagnose you over the phone, but certainly to give you some great information about what you need to do in order to go to your doctor and talk to them about what you got going on. It's opening up that conversation. All right, looks like George is going to be coming up in Minnesota. And, George, we're going to get to you, but first, let me get to this. Right here on SiriusXM 146. Be right back. Drivers, hey, I want to welcome you back, and we're talking some medical news and notes for you with Dr. Fahmi Farah, one of North America's leading cardiologists. And Dr. Farah, thanks for joining us. Say, where can folks find you on the web?
You can find me at www.drfahmifarah.com. You can also find me on Instagram and Twitter at Fahmi J. Farah.
All right, very good. Thank you very much for joining us on the program. Let's go to George on the line with us in Minnesota. George, welcome. You're on with Dr. Fahmi Farah. Question or comment?
Thank Thank you for my call. It's a question, I guess. I'll try and make it quick. It's about my wife. She has had shortness of breath, and she's having trouble walking. But she's also had like a 90-pound weight gain in the last 15 months. And we've had medical professionals that are friends of ours tell us that she needs to get into a doctor because she's probably got thyroid problems and maybe heart problems. But we can't find a doctor that will see new patients within like a year or some of them even 2 years out. How do we fix this?
Wow. Great question. What do you think, doctor?
Yeah, I definitely think your wife needs to seek medical help, especially for somebody who has gained that much weight in that short of a period, along with some of the other signs and symptoms you're describing. I would think that they would need a thorough lab work done to check everything, and particularly the heart. So they probably also need to see a cardiologist. So I would not wait for a year or two. The sooner, the better, actually.
Could he go, doctor, maybe to like one of those urgent care centers, at least try to get it started? Would that be a first start?
That may actually be. What part of the country is your wife in?
West Texas.
What part of, she's in Texas?
Yeah, West Texas.
Okay. Yes, I think for immediate access, like if she's symptomatic enough, then the emergency department would be the way to go, because then they can plug you in a lot faster. Urgent care, I agree with that. They can also maybe refer you to a cardiologist or a specialist a little bit sooner. And as last resort, I'm always happy to see your wife. I am in Texas, although not West Texas. I'm in the Fort Worth area. We also provide telemedicine. So if you need more urgent, within a week or so care, I'm happy to provide that via telemedicine.
Well, you're only 5 hours away.
Oh, there you go.
but
there you go.
She also has like constant exhaustion.
Mm-hmm.
Yes, those can all
it doesn't make sense to me because she's 18 years younger than me. She should not be more exhausted than me.
There you go. Of course.
Correct. I do agree that exhaustion and fatigue, as we were discussing earlier, sometimes those are symptoms of heart conditions. It could be many different things, but certainly it could be heart-related as well.
Yeah, in other words, George, she can see you via telemedicine, at least to get it started. Doctor, what would be the, let's get that phone number out there again for George. Where can he reach the office, right?
You can reach my office, Bentley Heart Clinic, at 817-720-5185.
I need to get a paper so I can write it down.
Oh, no worries, no worries. But it's, I think, George, you're taking the right step here because, that's, waiting a year or two, things certainly could get a lot worse.
Well, she's getting real frustrated because they keep referring her to doctors, and then when she goes to the doctor, well, yeah, we can see you March of next year. Or like I said, the one said not until May of 2027, and I'm like, do they realize what year it is?
Well, there you go.
That's very unfortunate. I do want to say that I do see patients from all over the United States. I have patients even abroad, actually, and we see them through telemedicine. So I'm more than happy to see your wife within a week if that's something that she needs.
George, you have a pen and paper?
Yeah,
if I can get that number again.
You bet. Doctor, if you would.
Sure. It is 817-720-5185.
Okay, I got it.
George, all the best,
man. It to her.
Yeah, absolutely. Let us know. Kudos to you for reaching out like that because, that's your loved one. And you want to make sure you get the best for them. And I appreciate the phone call. And, Doctor, that's another great way you can reach out to people, right? They can, if they're not in the Texas area, they can certainly do telemedicine with you. And that's a great thing. All of that came out of COVID. the telemedicine part,
Absolutely.
right?
Yes.
Yeah.
Telemedicine is one of the greatest things that has taken place as a result of COVID. It's probably the only positive, actually. But yes, it has completely changed the dynamic of how we provide medical care. And this was a perfect example of it. People who are in rural areas, we can now give them access to medicine much quicker right from their home.
Doctor, would you recommend against going to Dr. Google? And what I mean by that, typing in, thisisbotheringme.com, and all sorts of stuff is going to come up. Should folks be wary of that, Dr. Google, or can it be useful in some cases?
It's a little bit of both. I definitely advise caution when going on Google. There's nothing wrong with it, educating yourself with the research you're looking at, because Google will provide anything and everything, so you got to look at which resource you're looking at. American Heart Association, for example, is a great resource. They will provide you more accurate information. But I do advise against self-treatment or self-diagnosing. I do also advise, I get a lot of patients a lot of times, they read wrong information and they don't come on time, or they start self-treating, and they can delay their care by quite a bit in doing so.
No, golly, yeah, and that's why you have the MD behind your name. You got to go with the best. Got to make sure of that. Hey, congratulations! I understand you had a life event, and all the best with that, by the way. And congratulations to you. And Doctor, thank you very much for joining us on the program, Doctor. On the line with us, Dr. Fahmi Farah, one of North America's leading cardiologists. And if you're in Montana, if you're in Boston, or if you're somewhere else, she's available. All I got to do is call her, and then she'll set up, her staff will set up a telemedicine visit, and then you can go from there. Doctor, one more time on the phone number, website, before I let you go. Where can they find you?
You can find me at www.drfahmifarah.com. My office number is 817-720-5185. Clinic is called Bentley Heart Medical Center. You can also find me on social media at Fahmi J. Farah.
Outstanding, Doctor. Thank you very much. And we'll do it again real soon. I'll talk to you next week. That is Dr. Fahmi Farah on the line.